Welcome to All Things Med. This is your host, Ting Ting. We have very special guests today. All of them graduated from Harvard Med. So, so let's welcome Mr. Buting Ting. So, hello. Dr. Tambunting. And Dr. Gunting. So we have a very special topic for today. It's about what is the best pre-med. So a lot of upcoming college students are watching with us right now and wants to know the differences between pharmacy, nursing, and medical technology. So this is Dr. Gunting, awarded one of the best family medicine doctors in the US and is now working in Cleveland Clinic.
Hello. Good morning, guys. Thank you for having me here.
And next is Dr. Tambunting. She is now the medical director of her own hospital.
Hello, thank you for having me.
And last but not the least is Dr. Butingting. After being the top student of Harvard Med, he is now a senior surgeon in Mayo Clinic.
Good morning to everyone.
So I see you have different pre-med, right? So, but all of you are doctors now. So, can you please tell me a description of your pre-meds? So, let's start off Mr. Dr. Butingting.
So, good morning to everyone. So, I am Dr. Butingting. I graduated from Harvard University. So, what really nursing is? So, nursing focuses on the care of individuals, not just on individuals, but the care on the family and on the patients. And also nursing or nurses working collaboratively with the physicians. That's it.
Yes, very important job.
So mine is pharmacy. I graduated pharmacy. Basically, pharmacy it's about drugs, not just the drug itself, but also the side effects, the considerations what to take in dealing drugs, and also the importance while taking the drugs and well not to take it or not.
Yes, what do we do without drugs? Yes, that's true. I hate drugs. And yes, for the medical technology.
A medical technologist is a professional that handles or deals or tests body fluids and tissues, and almost any type of sample removed from any patient for testing.
So, if that's the case, why did you take up medicine and not stay in your pre-meds? I hear that it's very amazing. You have great descriptions from your pre-meds. So, why did you choose to take up medicine?
Honestly, I've learned a lot as being a BS medical technologist, but I suddenly felt like something was missing in my life, and that was taking up medicine, so I took medicine.
Okay, so Dr. Tambunting.
So I wasn't really planning to take medicine, but then again, at the end of the day, I realized that I still need to share my knowledge, my wisdom, and I guess being a pharmacist is not enough to share what my wisdom or knowledge as a in a medical field.
So, as many aspiring health workers are drawn to the field of medicine, the decision between med school and nursing school can be difficult. So, why I took medicine is that since I was a child, I really wanted to be a doctor. And I think and I believe that this is my passion to serve the people.
Oh yes, yes. Passion. Passion. No, yeah. Not everyone can get to be a doctor. Most child fails, but people like these very successful people. So we should follow their lead. And so my next question is, yeah, we have heard your descriptions, right? So what are the edges you have from other pre-meds? Of course, we have our different roles in the healthcare. So what are your edges?
Edges, I guess number one, the reason why we take up in the medical field is because we want the opportunities, right? Number one. And And that time, pharmacy was one of the in-demand courses in the Philippines, not just here but also in other countries. Opportunities number one is that we earn money for a living to help our families and friends, and of course the
Friends.
bottom.
Wow, you're so.
Yeah,
You're so
I mean yes, your
generous.
family, friends, and also bottom line is that
Can I be your
we give-
friend?
we give care to our individuals.
So nursing is a special profession wherein nursing or nurses possesses cognitive ability, not just cognitive ability but the technical skills when it comes in rendering care to patients. And also nurses possesses compassion and patience.
Everybody thinks that being a medical technologist is just a simple job, like just being in a laboratory, experimenting fluids and stuff. But it is where doctors base their diagnosis on our lab results. So basically, if I make one mistake, or if we make one mistake as a medical technologist, it's going to affect the whole progress of helping a patient with his sickness.
So being in med school is very hard. So since you are already doctors, you have studied a long time. So what teaching techniques could you teach in our upcoming college students? Because we all know that college is very hard.
Number one is that you're happy in what you're doing. Because if you're happy in what you're doing, you feel like you won't work on a day. It's like you do it not just because it's your job, but because you want it. You're happy, you'll make it, and we got this.
Well, I can say is that to all college students out there that love what you are doing, and also to all pre-med students, I think that really nursing is a good pre-medicine because it will make you a good doctor in the near future. And also, nurses are typically at the bedside most of the time. So, yes, nursing really is a good pre-medicine.
My only advice to people who want to take BS medical technology is that being a medical technologist is not that simple. It takes hard work, perseverance, and even a lot of patience. So if you love what you're doing, I think that you should keep doing what you're doing. And all I can say is that good luck to all of the incoming college freshmen. Thank you.
So we have heard a lot of convincing words from our guest today. Thank you very much. Thank you for coming. Thank you for being our guest. And I'm sure a lot of people learned from your experiences. And despite all the differences with the pre-medical courses, we are a team in giving our patients optimal care. So, thank you for watching All Things Med. This is your host, Ting Ting. Thank you.